Hi, I'm Gail Story. I'm a pharmacist, I'm a caregiver, and I'm a friend of the Zachis. And I'm here this evening to speak about seizure medication therapies. I created a handout, and I'm going to stick mostly to the handout. Seizures are often the first symptom of a brain tumor, and very frequently when a seizure occurs, that's when the diagnosis is made. It's contrary to the popular belief that it's headaches that are the first symptom, but they often go hand in hand. Not all people with brain tumors experience seizures. As you heard recently, it's the lower grade gliomas that are more frequent. The higher grade tumors, the malignant ones, have less seizures. And the seizures are affected by the areas of the brain, not so much how large the tumor is, kind of like in real estate, location, location, location. They can occur for many reasons in a person suffering from a brain tumor. It can be the tumor itself that's putting pressure on the brain. It's also creating swelling or edema, and it creates intracranial pressure. Also, they can be triggered by changes in medications. If a medication level is too high or too low, that can trigger a seizure. There can be scar tissue from surgery, stress, sleep deprivation, excuse me. So those are just some of the causes which you're aware of. And there's a lot of different considerations that go into selecting the correct medication. The anti-seizure medications are also called AEDs, or anti-epileptic drugs, so I'll refer to them as AEDs. They're also called anti-convulsive drugs. They're not useful in preventing the first seizure, and they're not used if someone's diagnosed with a brain tumor automatically to prevent a seizure. They're diagnosed usually after the first seizure occurs. And many of them act to control the seizures by modifying the electrical activity inside the brain. There's a lot of different challenges in providing adequate seizure control in patients with brain tumors. BTRE is something you may see in different articles that you read. It means brain tumor-related epilepsy. And there's a lot of resistance to these meds from different reasons. Sometimes the tumors themselves secrete something called proteins that prevent the drugs from working effectively. And there's also a lot of different drug interactions, not only with other drugs that you may be taking for unrelated diagnoses, but with chemotherapy, there could be effects from radiation. So there's a lot of different things that come into play with selecting the right drug. And there's also a lot of different side effects that are related to them. So the choice of the seizure medications could be influenced by age, by the type of tumor, and the ability of any specific drug to control the seizures. Many of them have not just, they have systemic effects, not just to the central nervous system or the head or brain. So a lot needs to be taken into consideration. And all of it can impact the quality of life, making it difficult to assess the response to other therapies. So, you know, sometimes there's a symptom and you're not sure if it's from the tumor, from the radiation, from the drug, from something unrelated from another medication that may be taking for blood pressure or something completely unrelated. So it gets pretty complicated. There's a lot of different seizure medications, and the ones that work most favorably are the newer ones. And I'm not going to go into each individual drug. I put them into the outline because it's just too confusing. And you know the ones that you take. If you may be taking more than one, you can look at it and see what the primary adverse reactions are. And I know when you go to get a prescription filled and they give you all of the information about a drug and you start reading about everything, and it makes you afraid to take it. I mean, it's some of the things that are very extreme can be scary, but there's a very low incidence in those. The pharmaceutical companies are required to list every reaction that's occurred. So it may be 1 in a million, and the possibility of your experience it is low, but they're listed anyway. I just did the major reactions. The newer drugs have fewer drug interactions and they have less side effects than the older medications. Drug interactions are thought to be related to the stage of the disease and other therapies associated with the treatment. Again, it's confusing. One of the ways that drugs are broken down in your body is through the liver. You know, the liver kind of filters all of the blood that's going through your body. And they not only break down some of the older seizure medications, but a lot of other meds that you may be taking. A lot of meds for the brain tumor. So what happens is when there's a competition in the liver for the drugs to be broken down, they're not all broken down the way they should be. Sometimes one will break down faster than another, faster than it should be when it's prescribed. And when that happens, you either get a higher concentration of one drug than another. And so that's why a lot of them need to be monitored. That's why a lot of the older medications are avoided, because you don't get good blood levels.